Okay, it is the top of the 10 o'clock hour. I know folks are still joining, but I do want to welcome you all to our second trauma informed care webinar in the series. Today, we are joined again by Giovanna Gicobbe, and she's going to be talking to us today about the adverse childhood experiences, or ACEs. And I would also like to let you know that the chat is open if you have questions. Or you can also use the Q&A, and we will be monitoring that throughout the webinar if questions do pop up at some point. I do know that we also have time at the end for a little bit of Q&A with Giovanna. So thank you again, Giovanna, for hosting and for joining us today. We're excited to hear from you.
Thank you for having me. I'm super excited. So welcome to Adverse Childhood Experiences, ACEs. So my area of specialty and expertise is in trauma and PTSD. I teach a trauma master's course at Rutgers University. I'm also a trauma consultant for all 4 of our state psychiatric hospitals. And I've also been conducting trauma research and PTSD research since 2009. So yeah, I've been involved in a lot of different areas of the trauma field. And if you would like to know a little bit more about me, I have it on the second slide. And you feel free to reach me at my email address. I'm more than happy to answer any additional questions after the webinar is done. Stormy, do we have, are they allowed to talk during it, or is it only chat?
So right now we have chat, but if somebody raised their hands and wanted to chat back in some ways, I can definitely open up that feature if you'd like me to.
Yeah, I mean, I'm trying to make it a little interactive. So I might ask a few questions. So feel free to ask me questions during the webinar. I don't mind being interrupted. And just remember, there's no right or wrong answers to this. So I like it to be, interactive somewhat. So today's agenda is we're going to define what ACEs are and also how to screen for them. We're going to look at the psychological and physical health effects of ACEs. We're going to examine complex PTSD and impact that ACEs has on it because there's a strong correlation. We're going to also understand counter ACEs and how they can help, and then discover ways to provide better services to clients who've experienced ACEs. So what are adverse childhood experiences? So the adverse childhood experiences actually came out of a research study from Kaiser Permanente. And this research study was done between 1995 and 1997. And what they are potentially traumatic events that occurred during childhood, so between the ages of 0 to 17. And what they found is they have a long-lasting effect on their lives. So not just their childhood, but they have a long-lasting effect on their adult lives. And what was really profound is that the long-lasting effect is like a health effect. So it's not just psychological, but they have long-term chronic illnesses. And the areas that they're looking at is abuse, neglect, and household dysfunction. And really what was profound in this is that they looked at over 17,000 participants. And you can see how it was broken down by gender, by race, and all they looked at was 10 questions. And those 10 questions, like I said before, are in the areas of abuse, neglect, and household dysfunction. And what many people don't realize is this exposure to adverse childhood experiences, it is associated with increased risk for health problems across the lifespan. So it's not just childhood. Like I said, it impacts your adult life, and it can go on chronically. And I will give all of you guys the opportunity to know your own ACE score in a little bit. So those 3 areas of focus. So the abuse, neglect, and household dysfunction. So for abuse, it's physical abuse, emotional abuse, and sexual abuse. I will say for the emotional abuse, people are often surprised that emotional abuse can have these long-lasting effects. So that was one that the ACE study captured. Then neglect, right? So then there's physical neglect, and then again, emotional neglect can have these long-lasting impacts on the child and throughout their adult life. And then there's household dysfunction. So with household dysfunction, they looked at a few things. And remember, this was done between 1995 and 1997. So some of these things needs to be updated also. But so they looked at the mother and stepmother who was abused. If a person in the household had a substance abuse disorder or a severe mental illness or was incarcerated. And then also if the child was not raised by both biological parents, it could have a potentially, impact on the child's life and, their future health problems. So these are some of these are the questions. There's abuse questions. So there's emotional abuse, physical abuse, and then sexual abuse. And these are the exact questions from the questionnaire. We will go over the questionnaire, but I did want to break it down for you, like which ones were the emotional abuse, which were the physical abuse, and which were the sexual abuse. So emotional abuse is, did a parent or other adult in the household often swear at you, insult you, put you down, or humiliate you? Because this could have a severe impact on a person. Act in a way that made you afraid that you might be physically hurt. So that's the emotional abuse question. And they answer it just pretty much yes or no. Physical abuse is, did a parent or other adult in the household. So it's when they're focusing on the household, it's anyone that's living in the household. Did they push, grab, slap, or throw something at you, or ever hit you so hard that you had marks or were injured? And then sexual abuse is, did an adult or person 5 years older than you ever touch or fondle you, or have you touched their body in a sexual way, or try to actually have oral, anal, or vaginal sex with you? So these are the three types of abuse questions. Then we move on to the neglect questions. So for the neglect questions, there's two. Did you often feel that no one in your family loved you or thought you were important or special? I've had a few people like question this one and say like, oh, how can that, have a negative effect on a person's life? Well, we're social creatures and we need our parents to grow. So this is something that babies and children really need, is to know that they're loved and to know that they're special and important. And then also, did you often feel that your family didn't look out for each other, feel close to each other, or support each other? We really need support in order to grow properly. And did you often feel that you didn't have enough to eat, had to wear dirty clothes, and had no one to protect you? I will say this one, when I was working in the state psychiatric hospitals, many of our clients complained about like not having enough to eat. And they always ask me, they're like, Miss Giovanna, is that trauma? Like not having enough to eat? And like they struggled with it and nobody really validated it to them. So when I validated it to them, it was something that helped them to start to grow and understand like their past impacted their current life. And then also, did you often feel that your parents were too drunk or high to take care of you or to take you to the doctor if you needed it? So these are the neglect questions. And the last one is household dysfunction questions. So were your parents ever separated or divorced? So the other thing, I just want to let you know, just because you have these ACEs, it doesn't mean that you're going to have these, long-term physical or emotional or psychological problems. There's things called counter ACEs, and these counter ACEs can lessen the impact. So we're going to talk about that later. So just because you've experienced this does not mean that your ACE score is going to lead to these things, but it can possibly be an explanation for some of your physical and mental health problems. Another one was your mother or stepmother often pushed, grabbed, slapped, or had something thrown at her? Sometimes or often kicked, bitten, hit with a fist, or hit with something hard, and then ever repeatedly hit over at least a few minutes or threatened with a knife or a gun. So remember, this happened in 1995 to 1997. Right now, we could probably broaden this, right? With abuse and household dysfunction, it doesn't just have to be the mother or stepmother. It could be many people that are living in the household that are raising a child. So that would be great to broaden it. But, this was a study that, was done in 1995 to 1997. Nothing like this has ever been done before. So this was a profound study that really impacted the way we look at abuse and how we treat children, because the way children are, brought up can have a severe impact on their adult lives. Another one is, did you live with anyone who was a problem drinker or alcoholic or who used street drugs? Was a household member depressed or mentally ill, or did a household member attempt suicide? And then did a household member go to prison? So these are all the household dysfunction questions. And there's a total of 10. So we're at number 10. I wanted to talk about when and how do we screen for ACEs? So if you work in a mental health facility, it would be ideal if all clients were screened for ACEs. And another thing is medical providers. If medical providers screen for ACEs, we could better understand maybe some of the medical problems that the client is facing. And we'll talk about that as we move along. What I would like to do is give you all an opportunity to take the ACEs questionnaire. It's nice to know our ACE score, and then also understand the health effects with it, and then also understand, okay, well, I'm not experiencing any of these things, and look at the counter ACEs. What did you have that protected you from these medical and mental health problems? It's also helpful just to understand the ACE questionnaire. So if you wanted to use it, if you're working with clients, then you can understand how to deliver it. It's a very simple one. So I'm going to share the actual questionnaire because here it's a little hard to read. So I'll share the actual questionnaire. One thing I do want to say is, before you use the screening form with a client, you definitely want to build rapport with them. And I wouldn't do this at the very first meeting with them. I know with this study, I believe they were just, screening people. I don't know if and it was in medical offices mostly, but I would build rapport first with the person before we start screening for ACEs with them, especially if it's a mental health facility. So you should know their ACE score within the month, but don't do ACEs in the very beginning. Build rapport after maybe 3 or 4 meetings, then you can introduce this type of assessment. And if the person is in crisis, this is definitely not something you want to discuss with them. They should be stable in symptoms and have coping mechanisms before doing an ACE questionnaire. So let's see if I can stop sharing, pull up my ACEs, and everybody will have a copy of the ACEs. Okay, so this is what the ACEs questionnaire looks like. This is the original one. So I always like to give the original one because this is where the data came from. I am going to give you an updated one, updated version. They did another ACEs study in Philadelphia with some updated information, and we'll discuss that as we move through the presentation. But like I just went through, this is the ACEs questionnaire with all the same questions. So it's for the first one, do you see the or? So if you answer yes to either one of these, it's 1. So if you answer yes to either one, it's a 1 for you. Okay, it's not a 1 for each of them, it's just a 1. So each question, the highest that you can score is 1. So it's not a half a point and a half a point, it's just like either or if it's both, it's still a 1. Okay, so we'll go through each of these, and if you have a pen and paper, or if you can remember it in your head, feel free. And let's go through your ACE score, and then we can look at what the ACE score means moving forward. So did a parent or other adult in the household often swear at you, insult you, or put you down or humiliate you, or act in a way that made you afraid that you might be physically hurt? So if either one of these are a yes, you have 1 point. And then the second one, did a parent or other adult in the household push, grab, slap, or throw something at you, or ever hit you so hard that you had marks or were injured? If it's a yes, then you put a 1. Did an adult or person at least 5 years older than you touch or fondle you, or have you touch their body in a sexual way, or try to actually have oral, anal, or vaginal sex with you? Number 4. So if it's a yes, you're going to put a 1. Number 4, did you often feel that no one in your family loved you, thought you were special or important, or your family didn't look out for each other, feel close to each other, or support each other? If it's a yes or a no, well, if it's a yes, put a 1. Did you often feel that you didn't have enough to eat, had to wear dirty clothes, and had no one to protect you, or your parents were too drunk or high to take care of you or take you to the doctor if you needed it? If it's a yes, put a 1. Number 6, were your parents ever separated or divorced? If it's a yes, put a 1. Was your mother or stepmother often pushed, grabbed, slapped, or had something thrown at her, or sometimes or often kicked, beaten, hit with a fist, or hit with something hard, or ever repeatedly hit, or at least a few minutes, or threatened with a gun or a knife? If it's a yes for any of those, put a 1. Did you live with anyone who was a problem drinker or alcoholic, or used street drugs? If it's a yes, put a 1. Was a household member depressed or mentally ill, or did a household member attempt suicide? If it's a yes, put a 1. And then did a household member go to prison? If it's a yes, put a 1. So then what happens is you add up all these ACEs that you said yes to, and the highest you can have is a 10. Okay. The higher your score, the more it's associated with physical and psychological and mental health problems. And I will give this specific questionnaire out to you.
Giovanna, we do have a question
Okay.
that's come up. Let me get it to pull up the right way.
Okay.
Okay. Okay, so the first question is this something that holds up with judges in family court when determining custody and looking at the best interest of the child?
That's interesting. I'm not like a legal expert, but this is something you can probably potentially discuss. I did work in the foster care system when I first started. And, these are things that you can bring up as, concerns that you have for the child.
Would you advise that this was done by a professional and not like a parent, maybe? Or inside of counseling, or is it something maybe
Well,
they put attorney on?
I would have a counselor, administer it. Definitely. Yeah. A therapist, counselor, psychologist. I also, like, medical doctors can administer ACEs, but if they're not really experienced with ACEs, then it probably, it would be better to have like a mental health provider than administer it. But if the child is having medical problems, you can potentially, relate some of it. Like they said that like children with this also have like higher like asthma rates, things like that. So.
Okay. We have another question that says, does number 6 need to happen prior to turning 18?
Let's see. Were your parents ever separated or divorced? Yeah, so it has to be, before before you turn 18. That's what it says, right? Does it impact you like after the age of 18? Yes, of course it can impact you after the age of 18. But they're really looking at for this is like childhood experiences, because the way the developing brain and systems work, it impacts the way like a child develops. So. Any other questions?
No, those were our only 2 right now.
Okay. So I think I just said this to you all. So once you add them up, you'll know your ACE score. As your ACE score increases, so does the risk of disease, social, and emotional problems. So they're saying it's like a dose relationship. So the higher, the more you experience these things, which is the dose, the more impact it can have potentially on you. So what are some of the impacts of adverse childhood experiences on ACEs? So it has some lasting impacts, like during brain development, it can change brain development, especially chronic trauma. So if it only happened once, less likely to impact brain development. But if they're having chronic traumas, like daily traumatic experiences, it can start to affect the developing brain in a child. It affects their immune system. And it affects their immune system because, so what happens is, and I think I described this in our last my last presentation, is that like children, adults, if you're going through a stressful experience, we go into fight and flight, which produces all these hormones in us. And it's the hormones, so cortisol, adrenaline. In these children that are going through adverse childhood experiences that are chronic, they have chronic activation of cortisol, adrenaline, and many of the other hormones in their body. And that's where the damage is coming from. So we are not made to have stress hormones constantly running through our body. And it changes. So if it's chronically running through our body and our body, doesn't have a chance to calm down and relax, cortisol can actually impact the brain negatively. It impacts our organs negatively. And this is where the impact is happening for physical health. It's changing the structure of our brain. It's changing our internal organs, our hormonal response to things. It's changing that. It changes how DNA is read and transcribed in children, okay? So if you're going through this as a child chronically, these are some of the effects. It affects the nucleus accumbens. That's the pleasure and reward center of the brain, and it's implicated in substance dependence. It inhibits the prefrontal cortex. This is like the front part of our brain. We need this front part of their brain to think clearly, to concentrate, to be able to learn, for organization, impulse control. Now, I will say that like in children, this prefrontal cortex, the executive functioning part of our brain is not fully developed. I think it's till the age of like 25. And I heard researchers say sometimes it goes all the way to 30. Our prefrontal cortex is not completely developed. So in a developing brain, it's even worse because the impact is happening early on. So do they even get to develop some of these like critical skills? And we'll see the world-renowned expert in trauma. He describes 3 ways it impacts clients coming up. It also has measurable differences in our amygdala. So our amygdala is our alarm system. So it's what picks up the danger and it sounds the alarm. Really interesting. The research is showing that people that have gone through a lot of trauma, especially children, in adult brains, they've seen their amygdala bigger, like, so it's larger than people that have not gone through chronic traumas. So it's very interesting. And their amygdalas are more sensitive. So it goes off quicker, which means that that stress hormone response is going off. The cortisol is running through our body. Adrenaline is running through the body. And sadly, they're saying that it has a 20-year difference in life expectancy, if not adequately addressed. So we can address these things. Even you could address them in adults, and it doesn't have to have this long impact. But if it's never been addressed, we also have adults that, you know, their amygdalas are sensitive, and cortisol is still, you know, pumping through adults' body. So it's doing this, like, so not only in childhood, but in a, like, they carry it into adulthood. And it's still having this profound effect on their lives.
Giovanna, we have another question in regards to the ACE test.
Mhm.
For number 6, they're also wondering if death of a parent at a young age would apply to divorce, to number 6 specifically, or if it's taken into consideration at all for ACEs.
Let's go back to the ACEs. Yeah, so it doesn't look like it's captured at all. It's literally what the ACE questionnaire says. So remember that, you know, this could be revised. And, you know, it was a groundbreaking study. So there's many things that can have an impact. And I would say, yes, the death of a parent could definitely have a profound impact. So this was, you know, done earlier in the 90s. But nowadays, you know, any kind of traumatic experience that children have that are chronic or long lasting, it could potentially have effect on their life if they don't have protective factors. So yes.
And another question, ACE number 7, can it also be the father or stepfather who was abused, or is it only focused on the stepmother and mother?
Yeah, so remember when I said that it was done in 1995 and 1997, these things could be revised. On the original study, that was all they were screening for. But if they were to revise it, yes, this is something we would take into consideration. The stepfather or father could, you know, definitely it can impact that, right? So it's like watching like you're being in the household, you're powerless to this, and you're seeing this happen. As you say this, like I remember having a client, so he watched his stepfather beat his stepmother chronically every day. And he took, like, as he was sharing, he's like, Miss Giovanna, he's like, I thought this was normal. He's like, I thought all like families had this happen to them, like that it was just like a normal part. He goes, but you know, it made me feel powerless. Like I was supposed to protect my mother. And it had a long lasting, profound effect on him where he found any authority figure a threat to him. And, you know, it led him with problems with the law and eventually in a psychiatric hospital. And as we were processing it, he began to understand where it was coming from, because for him, he thought it was normal. Like he really thought it was normal that this happened. So we validated, no, this is not normal. This is a traumatic experience. Your stepfather should never have done this to you or your stepmother. So yes, stepfather should be included in this.
Okay, and then one more question on number 6. What if the parents were never together in the first place? Is the intent of that question that you live or don't live in a 2-parent family for
Yes.
that protection level? So if,
Yeah.
Okay, so
Definitely.
if a father or mother was never present, it's a one person, it reduces the amount of protection the child would have in that situation, right?
Yes,
Like,
it could have an effect on the child. We can't say 100%, right? Because some people, like, you know, they say no, but it could potentially have a traumatic effect effect on a child, right? Not growing up with a mother, not growing up with a father, and seeing, you know, mothers and fathers around other children, yearning for that, it could definitely have an effect on the child's growth. So. Any other questions?
No, I think that was the last one.
Okay. So interesting. So remember, the data was done on 17,337 people. Out of all of those people, 67% of the population had at least one ACE score. Okay, so ACEs are, you know, pretty, you know, normal among our population. What they found, though, was among this, 12.6% had 4 or more ACEs. So remember, the higher your ACE score, the more you have a increase for physical and psychological problems. What they found is a score of 4 or more. You're 2.5 times more likely to develop hepatitis, 4.5 times more likely to develop depression, 12 times more likely for suicidality. With a score of 7 or more, you're 3 times more likely to develop lung cancer and 3.5 times the risk of ischemic heart disease. Okay. And some people are thinking, yeah, you know, like, well, if you go through all of this stuff, you know, you're more likely to pick up bad habits, you know, such as smoking or drinking. And like those things would put you more at risk of developing lung cancer or a lung disease or heart disease or hepatitis. Well, what they found was that's not the case. So remember when I talked about the cortisol running through your body? What they found was people that didn't use like drugs and alcohol, they still had this risk of like lung disease, heart disease, hepatitis. So they weren't putting themselves at risk by engaging in substances that might like cause these things. Just having gone through these traumatic experiences over and over again is something that severely impacts the developing body. So we found this. This was groundbreaking at the time, and it still is groundbreaking. And sadly, you know, we are just starting to get into this in the mental health field. And in the medical field, I don't see too many people still talking about this. But, you know, this is where my passion is, to like let people know that like this, you know, is preventable if we really understand what ACEs are and, you know, ways that we can prevent these things from happening, and also intervening early on in life. So I was telling you that there was a study from Philadelphia, so Philadelphia ACEs project, and it didn't, you know, it didn't look at over 17,000 people, but they did look at 1,784 people. And what they expanded was they looked at bullying, community violence, neighborhood safety, racism, and living in the foster care system. So this is where they expanded the questions, looking at some of these things. They found was out of those like over 1,700 people, 83% had at least one ACE score. I'm going to give you this handout, this questionnaire. So there's a handout at the end. I'm going to provide you all with this. And I even put the pages of where to find the questionnaire. Okay. But I found that like great that they were expanding ACEs. So how do ACEs impact physical health? So it does its damage in like 2 primary ways. So I think I already discussed this, but it induces a chronic stress response in the brain and the body. So this chronic stress response, it actually starts to lower immunity to diseases and make one more prone to physical and mental illness. Second, it's making a person more susceptible to long-term diseases, producing effects of behavioral and addictive disorders. And what we wanted to stress was the combined effects of chronic stress and risky behaviors and habits cause a tremendous amount of harm to the body and also social problems. I saw this, I thought it was interesting, an ACEs fact sheet on like, what are some of the diseases that are associated with ACEs? And you can see here, like diabetes, fibromyalgia, hypertension, lupus, multiple sclerosis, even obesity and rheumatoid arthritis, sleep disorders, stroke. These are many things that could potentially be connected to ACEs. We can't say 100%, right? Just because you have these disorders doesn't mean that it's completely related to ACEs. But what we're wanting to do is really like dig deeper and say, like, could you have had these things and could it still be affecting you today? And what I have found is traumatic experiences, no matter when, it stays in our body, like our body remembers them. And if you're not getting proper treatment for it, you can carry the after effects of traumatic experiences with you. We'll get into it a little bit more. So what are the neurobiological effects of ACEs? Early childhood experiences shape and change the brain. It's rewired to see the brain as see the world as a dangerous place. So remember I said that they have like it becomes like a sensitive amygdala. So that amygdala is our alarm system in our brain. And it's more sensitive to the world. So it reacts more easily. And why does it react more easily? It's learned that like things are happening, especially in childhood, it's happening to them. They feel powerless. So they see the danger. And as adults, they're seeing this world like, oh, danger could come at me anytime. So I have to be ready. So it's that feeling of having to be ready that it can send us into this fight and flight state of being. So also the pattern and repetitive activity reinforces certain brain circuits. So in a developing brain, right, what it's learning, the brain is learning, is that the world is dangerous, that it has to protect itself. And when you're constantly in a dangerous environment, it's reinforcing those brain circuits to see the world as dangerous. And so it's going to react more easily to things that people that haven't gone through this wouldn't react to. And then I already said this, the stress hormones are continually activated in this person's body, in this child's body. So I do want to stress that it's happening in childhood, but if it's not properly addressed in childhood, it leads to an adult body that's being chronically activated with epinephrine, adrenaline, cortisol. I like this quote, so I put it in here. It says, when you think of something stressful, your cortisol rises. If your cortisol rises, secretory hemoglobin A goes down. When your SIGA goes down, you become more prone to infection. This is how worrying can make you physically ill. And that's just the stress of worrying. Could you imagine going through traumatic events on a daily basis? Like there's so many things that's going on in our body that we take for granted and that we don't know about that really impact us and our physical health and our emotional and psychological health. So I know that I've talked about the autonomic nervous system in our previous presentation, but I just wanted to give us a little bit of a refresher so that we can make better connections. So we're going to go through this quickly, but ACEs, it has lasting effects on the autonomic nervous system. And that autonomic nervous system, it runs along our spine from the brain stem. So it's down here. I don't know if you guys can see me, but like our brain stem and like straight down our spine all the way to the base of our spine. So like the tailbone of your spine, that's our autonomic nervous system. And what they found is their brain and autonomic nervous system is on guard and constantly scanning for threats. So I guess I'm reinforcing what I'm saying. So their sympathetic nervous system, that's our gas pedal. That's what gets us ready to run or fight off our attacker. It's frequently turned on in children that have gone through these traumatic experiences. It also carries on into adulthood. And then they have difficulty activating the parasympathetic nervous system. The parasympathetic nervous system is what makes us feel calm, cool, and in control. So I just told you the autonomic nervous system runs along our spine. It helps us to keep safe and reacts to danger. It acts unconsciously and regulates bodily functions. So it regulates our heart rate, digestion, breathing problems, blood pressure, pupillary response, urination, sexual arousal. So like, it's interesting, but like, if you think about digestion, right? So if you're feeling physical symptoms in your body, it's coming from our autonomic nervous system. And when you're in like that stress response state, you know, when you're feeling like maybe a little nauseous or something, it's coming from the autonomic nervous system. Like, it's real, it's really happening. It's not like a psychological thing. So our nervous system is trying to protect us from either real or imagined threats. So remember, people that have gone through, and children who have gone through multiple traumatic experiences, they're going to see danger where we don't see danger, right? Like, if you haven't gone through many traumatic experiences, your nervous system hasn't been sensitized to experience it. So remember, well, I don't know if I said this, but it changes your nervous system. Trauma, adverse childhood experiences, it changes our nervous system, how our nervous system works. So like I just described, we have two divisions, the sympathetic and parasympathetic. So you think about that as our gas pedal, the sympathetic, it revs us up, prepares us for stressful emergencies. It gets us ready to fight or flee. We need this, right? Like, we need it, but we don't need it on all the time. We need it when there's danger. And for people that are chronically going through danger, their sympathetic nervous system is usually turned on more often. Our bodies are not designed for that. Our bodies need rest. It needs time to relax. If you're not relaxing, you can't put on that. Like, when you're in a relaxed state, you're in the parasympathetic nervous system. That's what our body needs to actually restore itself, to heal itself. So if you're in a sympathetic state all the time, it's going to be difficult to actually start to heal itself. We need to be in that parasympathetic state. So think about that as your brake system. So it calms us down by lowering our heart and blood pressure. It also helps us with everyday activities like digestion, waste elimination. It helps us to feel calm and in control. Also, these systems, they regulate each other. So it helps with homeostasis in our body. But I want to stress that most people that have gone through chronic trauma, traumatic experiences, they have higher, that have higher ACE scores. They're stuck oftentimes in the sympathetic nervous system. Which, when you're in the sympathetic nervous system, remember, cortisol, adrenaline, and all the other hormones are running through your body chronically. We don't need it chronically running through our body. We only need it if we're really in a dangerous situation. And for some children, they're chronically in a dangerous situation. And just to, just really quickly review what survival mode is. So for some folks, they're chronically in this survival mode. And it's these reactions to threat. So either fight, flight, or freeze and fawn. We don't choose it. It's not a cognitive thing that happens. Our bodies make this reaction, make this decision quickly. So the autonomic nervous system, it picks up, so there's the amygdala picks up threat. So the amygdala is in our brain, and automatically it goes into fight, flight, or freeze or fawn. So usually if you can't run from your attacker, you go to fight because you're going to fight it off. And then if you can't fight your attacker off, usually you go into this freeze or fawn state and you don't make the decision. You do not make this decision. Your autonomic nervous system makes the decision. I also wanted to go over, because I think this is important, physical trauma, like traumatic experience versus psychological trauma, okay? And my question to you is, what's the difference between psychological trauma and physical trauma? Feel free to put it in the chat or speak to me. But what's the difference between psychological and physical trauma?
Physical you can see and psychological you can't.
Yes, yes, definitely. That's exactly. So trauma is an injury, okay? Trauma, like the word trauma is an injury. And with physical trauma, we can see it, right? Like these are right in your face. If you touch these and a person screams out to you, you're going to be like, oh my goodness, I'm so sorry. You know, like I can understand why you screamed at me, right? With physical trauma. With psychological trauma, when you see a person react, right? And you probably might have triggered them, not on purpose, just like when we bump into a person that has a, you know, a broken arm and they scream out in pain and they turn around and you see that, oh my goodness, like I'm so sorry, I didn't mean to hurt you. With psychological trauma, it's the same thing, but we see these behaviors and we're like, sometimes we pathologize them and it turns into a mental illness. And oftentimes it's psychological trauma. And we are, you know, we look at them and we're like, oh, you know, you're out of control for no reason, but it's the psychological trauma that they're reacting to. So that's one thing that I want to stress, is that psychological trauma is actually an injury. It's an injury that we can't see, but it's a physical injury, right? It's injuring the way our nervous system reacts. It's changing our brain, the way our brain reacts to stimuli. So just keep that with you when we go through the next few slides, that psychological trauma, it's an injury and it causes psychological issues, but it's really coming from a physiological state. It's a physical injury to our autonomic nervous system and parts of our brain. So our limbic system, our reptilian brain, and then the human brain that we develop, that executive functioning, the frontal part of our brain, it can't work to reason through things. So that's parts of the reasons that we have to understand that trauma is an injury that we can't see. Tia Torres had a quote, and it says, "The scars on the inside take longer to heal than the one on the outside." And I love that quote because it really brings and captures what's going on with psychological trauma. So psychological and emotional trauma symptoms associated with ACEs that actually follow us into adulthood. Difficulties controlling emotions like anger. So they have a hard time controlling anger. But, you know, what is the fight response, right? You go into fight. It's fight, flight, freeze. Fight is actually anger. So they have difficulties controlling anger. Difficulties concentrating and paying attention. This is like the important and interesting part of how our brain works. So I was talking about executive functioning skills, and it happens in our prefrontal cortex, the front part of our brain. It's called the human brain. I think I went over this during our last presentation. So that front part of our brain, it controls attention, concentrating, learning. As soon as our amygdala, that alarm system, goes off and we go into fight and flight, it actually it shuts down because our body is trying to save ourselves. And it's just automatically reacting to save ourselves. Our autonomic nervous system takes over. And that human part of our brain that actually pays attention, that like concentrates and stuff like that, we have a hard time accessing, or for sometimes it like completely shuts down. You see people with irritability and mood swings. A lot of folks that have gone through psychological and emotional traumas, they have a hard time trusting people, and with good reason, right? Like if as a child, you have been always hurt by people, your brain learns that people are not to be trusted, that they're dangerous. Especially if they have caregivers that were abusing them, like the people closest to them are abusing them, you know, they're going to generalize and say, well, if my caretakers are dangerous, how can I trust anyone else? And with that comes difficulty maintaining friendships or relationships. They also have a hard time, like they feel disconnected and numb. So that's something they struggle with. They also struggle with fear, anxiety, and panic attacks. And with good reason, right? If you're chronically in this sympathetic state, and chronically running cortisol through your body and chronically seeing the world as a dangerous place, of course you're going to feel fear, anxiety, and panic attacks. They also have intrusive thoughts. And some of the intrusive thoughts, they actually blame themselves, like, I'm a bad person. Which leads to feeling hopeless and sad. And when we look at some of these, right, we can, assume maybe some mental health diagnoses, feeling hopeless and sad, like chronically, like it can lead to a major depressive disorder, irritability and mood swings. We can see that with bipolar disorder, difficulties with concentration and paying attention. We can see that with ADHD, right? Or ADD. So we can see where these psychological and emotional, like trauma symptoms, can really have a profound effect on the individual, on the child's life, and it can lead to these lasting effects into adulthood. So Dr. Bessel van der Kolk, he is one of the major researchers and clinicians in the area of trauma and PTSD. He wrote a great book. I suggest everyone reads it, especially, I think it's a great book for anybody to read. It's called The Body Keeps the Score. If you haven't read it, if you have read it, you probably understand why I'm telling everybody else to read it. But he talked about 3 ways childhood trauma affects adults. And these are the 3 ways. He said that it affects, so going through traumatic experiences, childhood traumatic experiences, it affects attention. And with the attention, it's difficult time being able to focus, a difficult time sticking with things, concentrating on things, and filtering out irrelevant stuff. Okay. So adults that have gone through childhood experiences, and even in developing children, they're having attention with, they're having problems with attention. They're also having problems with attention in adulthood. Okay. The second way is affect regulation. And what he said was, our emotions tell us what to do and where to go. But those who have been traumatized, their emotions become too large or too extreme or too quiet. Once these emotions become activated, it's difficult to shut them off, and they get stuck in the emotion for longer. So it could be days that they're stuck on this one emotion, compared to someone who hasn't gone through chronic traumas, where the emotion might last only a few minutes. Third is areas of relationships, and we've been talking about this. So he's reinforcing this. People who are chronically traumatized have a perception of the world that people will hurt them, not make them feel safe, and they feel helpless. So they position themselves to be on guard. They feel that the only way to be protected is actually to be aggressive or even arrogant. or oppositional dependent or compliant and please everyone. So the area of relationships is something that we can work on, especially in the mental health field. So my question to you, if you do work with people or with children, do you have any clients that struggle with these things? And do you think that it might be connected to their childhood issues or traumas? Anybody?
You're
I
welcome to
would
put it in chat, but also we did have a couple of questions that
Okay.
popped up while you were talking, so we can kind of address those.
Sure.
Somebody asked, the ACEs score you stated, the higher the score, the more issues you may have as an adult. What if a person only has a score of 1 or 2? Can that person have illnesses related to their score? Their example was they know someone who at a very young age had very little to eat and also had to take over parental duties due to language barriers. So loving home, everything's good, but you have one kind of predominant traumatic experience. Can that still play a role?
From somebody that studies trauma, I would say yes, it can definitely have a profound effect. And then we have to also look at their counter ACEs. So if they don't, and we're going to talk about counter ACEs, but if they don't have enough counter ACEs, right, it can also have a lasting impact on a client, regardless of their ACE score. So not having enough protective factors, regardless of your ACE score, can have these negative impacts. So I will say yes, it can definitely have an impact on a person. And you said that they took on like the duties of a caretaker?
Yes.
So who was caretaking them? Right? Like if they took on the duties of a caretaker, there was no one to really take care of them as a child, right? To help them grow. They didn't have that support. They had to provide the support. And as children, right, we need that. We need that in a relationship. So that's something that's chronically happening to them every single day. So I can see where that can have an impact on their adult life. So yes.
And one person in the chat did say that it's definitely connected to childhood traumas, as far as the question you asked. But how do you feel about us launching a poll for that question? Just to
Sure.
Yeah. Okay. So what was the question again specifically? No, Giovanna, for your question, I'm sorry, it wasn't clear.
Oh, I thought you meant the question that we were just discussing. Are you talking about which question? Like the one
You
that
had
I had
asked the audience the question in regards to how childhood, or do we know of anyone or the clients we deal with?
Yeah,
we
so I asked any clients you might have that struggle with these 3 issues, and do you think it might be connected to their childhoods? So I guess, like, do they have clients that might have these issues and that they feel like it's connected to their childhoods? So current adults, right?
Okay, I'm gonna launch that poll now.
Okay, cool.
If it loads. Okay, you guys should all see a poll that's popping up.
Can I speak out?
Yes, Michael, go ahead.
Yeah, while we're doing this poll, I think that a question like that is to some degree a loaded question because we are all products of exposure and experience.
Mhm.
And as you mentioned in your previous example, where this child continuously saw his stepmother being abused, and he thought it was a part of normal life. So therefore, for many parts of his life, that was compartmentalized. And just
Mhm.
when it came to relationships, he had a skewed view of relationships. And I think that all of us, when we examine all of the different components of our lives, we will find people that act certain ways in certain periods or certain areas of their lives. And depending on what our exposure and experience is, how we might interpret, their action. So I think that that's something somewhat of a loaded question where, yeah, everybody is not only knowing somebody, but in some way probably affected themselves by things that happened in their childhood, whether they're listed here or whether they're not, whether they would be considered as traumatic or whether they might be subliminal traumatic, where, well, yeah, that was going on and it's not really that big a deal, but it sure did affect your perception of how you think, how you interact with people, how you respond to certain situations, even to the point of some people being really outgoing, whereas other people may be a little more reserved. There may not be anything wrong with it, but it may be directly related to things that happened in their childhood where they just found it better to listen a lot and speak a little. So,
Yes.
I think that I just wanted to throw that down, that it's
Yeah,
a
no,
little
you're correct. It is a loaded question. And it's made to also like normalize. We all go through traumatic experiences in childhood, in adulthood, and it could have profound, lasting effects on our life. And sometimes what happens that I've seen in the mental health field, and what I'm hoping to do, is that we pathologize these things. We pathologize them. We turn them into disorders rather than saying, could it be like the childhood experiences that might be causing some of my symptoms, or even the adult traumatic experiences that might be causing some of these symptoms? And what happens is in mental health field, we ignore the trauma and like the traumatic experiences and the long-lasting injury that we have on our autonomic nervous system and our brain, right? We ignore it and we're saying like, oh, no, we can't go there. We're not going to talk about this, right? And we don't help the person in terms of their traumatic experiences and trauma symptoms. We ignore it. And what I've found in some of our research studies, so there's research that connects borderline personality disorder, right? That's a disorder, to childhood trauma. Okay. And what they found is if you treat their trauma symptoms, they no longer meet borderline personality disorder. We saw that in one of the research studies that I was doing, that, like as soon as you start to treat trauma symptoms, so they go to trauma therapy, as you start to treat the trauma, the symptoms start to go away, including some of the symptoms like attention, affect regulation, areas of relationships. When you start to treat the symptoms of trauma, these symptoms start to diminish because you're actually addressing some of these issues. So when I look at this, right, the 3 ways childhood trauma affects adults, if you've gone through a lot of traumatic experience in childhood and you're experiencing these 3 things, I can see this as an ADHD diagnosis as one of them. So we give the diagnosis, but are we treating the trauma symptoms? So that's where one of my passions lies, is that I would like to see trauma be ruled out before we start pathologizing symptoms, and connect it. Maybe, maybe they have ADHD, but maybe we should still treat the trauma symptoms, or whatever other mental health diagnosis we give people. The providers diagnose people with. So
we do have one more comment in the chat. And they say, while working in human resources, supporting an agency who works directly with the population experiencing homelessness and poverty, it is imperative that as a social service industry, that we understand how the people we serve are showing up.
Yes.
There's a lot of work to be done to stay calm and consistent when someone who has experienced great trauma is currently in fight or flight.
Yes, and homelessness is a traumatic experience. Could you imagine being homeless, not being able to have a safe place to go home to. And I worked with a lot of people that were homeless in the state psychiatric hospitals. That was one of their fears, that like they didn't want to be, like, some of them were not ready for discharge. They'd rather stay in a state psychiatric hospital than go like out into the community, because they were fearful of becoming homeless again. Because being homeless, you know, you're more prone to being attacked, you know, like physically assaulted, you know, like you're not having any of your needs met, right? Like, how do you, you know, how do you afford food? That's even traumatic, right? Not being able to eat. So yeah.
Thank you for that comment.
So I would, you know, there's a broad range of different traumatic experiences that can have a long lasting effect on us. So connected to ACEs is a disorder. It's not part right now of the DSM-5, but it's called complex post-traumatic stress disorder. And this complex PTSD, or CPTSD, it develops in people who have endured chronic trauma that continues or repeats for months or years at a time versus a one-time traumatic event. Some have suggested that the current PTSD diagnosis did not fully capture the severe psychological harm that occurs with prolonged repeated trauma, okay? During long-term traumas, the victim is generally held in an extended state of captivity, physically or emotionally held, right? So you can see with childhood trauma and those ACEs, those ACE scores, right? They're, as a child, you are like powerless, right? Like you're stuck in the state that you're in, you know, if it's a home, you know, like you feel pretty stuck, like the adults around you are supposed to be taking care of you. And instead of taking care of you, they're abusing you. So in these situations, the victim is under the control of the perpetrator and unable to get away from the danger. People with high ACE scores are more susceptible to complex PTSD. So what types of trauma increases the likelihood of developing complex PTSD? Some of these traumatic experiences could be long-term domestic violence, long-term physical abuse, long-term sexual abuse, long-term child emotional abuse, you know, people that are refugees, concentration camps, human trafficking, enduring war. Like one great example right now is the Ukraine war. You know, people that are experiencing some of these things can develop complex PTSD. With complex PTSD, it's exhausting, painful, and debilitating. Survivors endure toxic level of stress, debilitating anxiety. They get emotional flashbacks, something that is not often talked about. Feeling isolated, feel different to others. They feel they can't trust anyone. They feel this profound sense of shame. Compassion, patience, and empathy are vital to working with these folks. And usually with people that have this complex PTSD, we label them with borderline personality disorder. And often in our field, with like the mental health field, it's a stigmatized disorder, and it doesn't come with compassion, empathy, or patience. So it's something we have to be aware of. So what additional problems are associated with chronic traumas? So those who experience chronic traumas for months or years, and total control by another may experience difficulties in the following areas. Emotional regulation. So, you know, they have anger, suicidal thoughts, persistent sadness, self-perception. So they're like how they perceive themselves. They may feel helpless. They have profound shame, stigma, So they feel stigmatized, guilt, and a sense of being different from other human beings. And I mean, I can see where, like, as they were, growing up, they were treated differently. And relationship with others. You're seeing this theme about in areas of relationships. So examples include isolation, they have distrust, or some of them, like, they have repeated search for a rescuer. And that could come from a child, right? Like, as a child, you're looking for someone to take care of you, to save you. And then one systems of meanings. So they may include a loss of sustaining faith, or a sense of hopelessness and despair. So these are mental health diagnoses that are often related to childhood traumatic experiences. So ADD, ADHD could be related to traumatic childhood experiences. Borderline personality disorder, that could be related to traumatic childhood experiences. Actually, that one is highly correlated. Anxiety and depressive disorders could be related to traumatic experiences. So oftentimes providers are giving these diagnoses and they haven't looked at their traumatic history. So either childhood history or adult history. But what we found is traumatic childhood can lead to some of these disorders. Dissociative disorders, obsessive compulsive disorders, addictive disorders. I will say with addictive disorders, they're highly correlated with traumatic events and with traumatic events that happen in childhood. So addictive disorders, I mean, they are trying to cope. They're using drugs and alcohol to cope. So some of the addictive disorders, substance use, eating disorders, gambling. So some of these addictions could be stemming from traumatic childhoods. So my question to you is, do you know people diagnosed with these disorders? And if yes, do you think it might be related to a traumatic history? And I'm not asking you to tell me who you know. I'm just saying, do you, like, when you step back and think about, like, listening to this presentation saying, they never, like, really looked into the trauma history. I see thumbs up.
Yeah, and we're getting lots of messages in the chat that agree with that. And one person specifically said, most of the people they know with BPD diagnosis have significant trauma in their childhood. And I would agree with that person as a foster parent, where, some of the children I've seen come through, I mean, complex trauma for sure. And that same diagnosis. So. And I don't know if I've ever personally thought or related those. I mean, the trauma exists, correct? But the correlation to the impact mentally, some things stand out maybe right away as like, yeah, of course you're going to have anxiety and depression and kind of some of these other things. I don't think it immediately clicks naturally or organically to say things like ADD or ADHD or borderline personality disorder or even OCD could be an impactor, unless if it directly manifests in the same trauma that they experienced, right? Like being really particular and in certain ways about certain things with OCD that make them feel comfortable, you're like, oh, that's trauma. But I don't know personally if I could say that BPD was something that stood out as something that was a product of the trauma some children experience. And that's really a very challenging diagnosis to deal with, to see through the mess that comes at you, even for our agencies, right? Sometimes people walk in with those trauma responses on the outside, and it's not easy to like somebody stated earlier, to stay calm and see through that, to know where they're coming from and why those responses are hitting them first. So thank you for that. And we had a few more comments pop up in the chat. The whole family is the whole training is my family home right now. And they're dealing with a personal situation and, you know, the trauma bond that comes from, you've talked a lot about preventing traumatic experiences, but getting them out of those situations, you still have to start healing them at an earlier age. And that's going to create, there's a trauma bond that comes from that makes that cycle hard to overcome.
I do want to say, like, it's not hopeless either, right? Like, if we can intervene early, we can actually treat the entire family. Because oftentimes what I have seen when I worked in the foster care system is that those who are abusing were abused. They were never, like, it was never intervened with earlier. So they're passing some of their behaviors, how they were treated, onto, you know, their current, like, family and their children. So
Somebody else commented as well that they're thinking that some of these people that seem to have most of the tendencies wrapped up into one probably have these issues due to ACEs. So maybe not one disorder, but some features or characteristics of each disorder, you know. And these specific things that you're talking about sometimes can be hard to differentiate or be diagnosed pathologically, right? Like you have to go through a process to say, where do you fall in? Because a lot of those symptoms overlap with each other.
yes.
So, okay.
Yeah, and I think some of them have become, like, you know, easily, like, oh, this person is having these symptoms, and it's easier to just say, oh yeah, it's borderline personality disorder. And it's heartbreaking when you hear, like, it's happening, like you're diagnosing a personality disorder in children, right? And it's just behavior problems. Sometimes it's these behavior issues, and you just turn, like, they're so young to have developed a personality yet, you know, like, usually personalities, you know, it takes a little while to develop your personality. And it's more reactions to the environment, what's going on. And we learn self-regulation from our parents. And oftentimes with borderline personality disorders, they have a really difficult time with regulating their emotions. But regulation is taught. It's not something you naturally have as a child. It's taught. So once we're able to intervene and teach some of these affect regulation and co-regulation skills, some of those symptoms start to diminish. But so that's why I say, like, the trauma symptoms, if we can start to treat trauma, many times they will not meet criteria for some of these disorders. So I can't say all of them, okay? But I'm just saying, like, let's look at trauma first, and treat the trauma, right? Treat it before we go on to, you know, just looking at them pathologized with these disorders.
Absolutely.
Anybody else?
Other people that have seen the correlation between the trauma and the disorder as well have commented. So I think a lot of the folks on this call have seen these things firsthand with the work that they do every day.
Okay.
Okay, I will let you continue on.
Okay.
We have about 12 minutes left though.
Okay, don't worry. I think we're almost there. I also wanted to just go into, like, the impact of mental illness and ACEs on functioning, especially as adults. So this leads to some of the adult issues, right? So many clients with mental illness, they have 4 or more ACEs. Many are stuck in that survival response, and they don't feel safe. So that amygdala is always going off. They're always in the sympathetic state. So many struggle with social interaction, social cues, and maintaining relationships. Many struggle with a lower tolerance for stress. So their stress response, they respond like in that fight flight state. That results in behaviors that we see, right? They automatically can go to aggression, defiance, or just like plain old checking out. The other problem, right, like with ACEs, is it can lead to issues with employment. So employment issues. Also, I would say, like, it's also like, if you have like a higher ACE score, you're going to have a harder time in school because that prefrontal cortex, like, is not engaged. You're not able to think. So like school also requires, concentration, attention. So both, like, if they want to graduate from high school, get a college degree, and then on top of that, maintain employment. So all of these things impact the person. We can see why some people might wind up homeless, right? Because you're not able to maintain that employment. You never develop those skills. And that's taught in childhood. So how does it impact a person's ability to work? They have difficulty following instructions, difficulty trusting and engaging with colleagues, difficulty with people in authority, like supervisors, bosses, and management. Remember, if you are growing up with parents who abuse you, or any kind of caregiver that abuses you, they're authority figures in your life. You carry that on with you. Difficulty maintaining motivation, difficulty following through on tasks, misreading social cues, and difficulty going to work or calling out sick. So this is how that childhood trauma can eventually lead to a person's ability to work and maintain employment. And I think it's important, right? Like, it's who we are right now, like how we identify ourselves. So that's something we don't want to ignore. Then there's positive childhood experiences. They lessen the impact of ACEs. So when a person has 4 or more ACEs, having a high number of counter ACEs lessen the negative health effects they experience as an adult. So there's family protective factors. So if you have a higher ACE score, but you have some family protective factors, it can mitigate ACEs. So if they have any kind of caregivers that can meet basic needs of food, shelter, and health services, a caregiver that has steady employment, caregivers that engage in parental monitoring, supervision, and consistent reinforcement of rules, families where caregivers or adults work through conflicts peacefully. So if they've experienced that, families where caregivers help children work through problems, and families that encourage the importance of school for children. So any kind of family protective factors, maybe not the immediate family, but some kind of family protective factors, it can mitigate some of the ACEs. Then also they looked at community protective factors. So if the child can go to their community where residents feel connected to each other and are involved in the community, that's a protective factor. Communities where violence is not tolerated, communities where families have access to safe, engaging preschool, after-school programs. These are protective factors. Communities where families have access to nurturing and safe childcare, where they have access to mental health services, where they have access to medical care. So here are some other examples of counter ACEs. So having a caregiver who you feel safe with, having a predictable home routine, having teachers who care, having mentors, having positive friendships and peer networks, having close-knit neighbors, having opportunities to have fun, having beliefs that provide comfort to you, feeling comfortable with yourself and liking school are all counter ACEs. So if you're having some of these counter ACEs, they can mitigate high ACE scores. Also, they found that if you don't have enough counter ACEs, that can lead to poor health outcomes, regardless of the number of ACEs you have. And lastly, I think I gave this in the last presentation, but this is really the ways to help clients heal. And it talks to everything that we just talked about, okay? So creating a safe place, educating your clients on ACEs, teaching them coping skills, right? So that's that affect regulation. Building support networks, right? That's the part of them having problems with relationships. And lastly, building self-efficacy, right? Because in childhood, like they didn't have anybody to help them with their self-efficacy. And that leads to that hopelessness and something's wrong with me feelings. So those are the 5 ways that I have found that providers can start to use to help clients to heal. And I know we have 5 minutes. And I will give you guys this handout. I would like to go through each one of them, but I don't think we have enough time. We're almost at the end of the presentation. I wanted to give a little bit more time to ask questions, but I will put this out as a handout. Also, you can reach me anytime through my email. This is such a great TED Talk. Please, if you have 15 minutes, watch it. She's amazing. Her name is Dr. Nadine Burke. And it's how childhood trauma affects the health across the lifetime. It was such a great TED Talk, 15 minutes. You will not be sorry. Pass it on to your colleagues too that couldn't attend. It's wonderful. So I just want to put that in there. And then you'll have handouts. So a handout on understanding ACEs, the ACEs questionnaire. There's also, oh, I see a mistake, an adult ACEs questionnaire, expanded ACEs survey. So the one that I was telling you about, the 5 ways to help our clients heal from trauma, and also creating a trauma-informed system of care. Because if we don't treat clients in a trauma-informed way, we actually perpetuate more trauma in their lives. We can prevent it by using a trauma-informed approach to working with clients. So lastly, I just wanted to, I know we were discussing questions before, but do you have any other questions and or comments about, the presentation, anything that you heard or, yeah.
I just wanted to say thank you because I've learned a lot.
Great, I'm glad.
So thank you for this whole series. I think everybody in my company should watch it. So
yeah, thank you. Yeah, and if you need anything else, just let me know and I'm happy to pass on information.
Thanks.
Kelly had asked if you'll get the slides. We'll also send the slides out as well, just as a reference point to go back. And to go back to your previous slides about what providers can do, it aligns with everything that's happening inside of community action as a support system and a way for people to connect inside of their communities and be provided with those resources. I think this training is important to remind us how our clients are coming to us on a daily basis. And that is why we do the things that we do, is to help repair some of the lack of things and resources that have been accessible to people. And they're doing a lot of really great work out there. So I thank you. I don't see any other questions popping up, but a whole lot of thank yous. There is a survey after this training, so I do ask if you guys could complete that with all of the information or anything else that you feel like you would like to cover in our next trauma series. We're going to continue all of our trauma learnings into the next program year. And so I would really like to make sure that the learnings and the opportunities that you're given meet you where you are in your trauma-informed care journey, to give you the tools to continue to assist your clients and yourself personally. How is that impacted in the work that you do?